immediately. When can a patient of an ectopic pregnancy plan to conceive after the medical management of ectopic pregnancy? If there is a single dose methotrexate has been given, then we advise the patient to leave one ovulatory cycle after the complete beta HCG resolution, and then they can try after one ovulatory cycle. But conventionally, I advise to wait for at least 3 cycles. Since methotrexate is an anti-cancer drug, it would have an effect on the follicle, and that follicle, the life cycle of the follicle is about 90 to 100 days. So I would advise 90 to 100 days to at least pass after giving the last injection of methotrexate, and then the patient should try to conceive. Once the beta HCG has become 0 after 3, 4, 5 weeks, the complete resolution of beta HCG is an absolute must. Once beta HCG has become 0, then I gave a good 3 weeks course of doxycycline. I gave a good course of probiotics, because I firmly believe that most likely ectopic pregnancy is because of pelvic inflammatory disease. Pelvic inflammatory disease damages the cilia. While that damaged cilia cannot be reversed and that cannot come back to normal cilia, but whatever further damage should not occur, and that is why I give 3 weeks course of a doxycycline along with a good liberal dose of pre and probiotics till the patient conceives. And I have found this method very helpful in my practice. There have been at least 5 to 10 patients who have conceived, delivered after getting a medical management of ectopic pregnancy done at my place. Most of the people fear after the removal of one fallopian tube that their chances of pregnancy would be less. Yes, overall chances are less, but they usually do not find problems with conceiving. Most of the people conceive with single fallopian tube also. So in summary of ectopic pregnancy medical management, while it is definitely the first line of management of an ectopic pregnancy, it is not always the optimal line of management. Patient should be thoroughly counseled, and as a doctor you have to make sure that patient would be always coming for visits. Follow-up is an absolute must for a medical management. Patient should be mentally ready that any time the beta HCG